Pediatricians across the nation are seeing a dangerous decrease in routine vaccinations for children. Local health officials say vaccinations for preventable illnesses like measles and whooping cough are down, creating a dangerous situation for vulnerable children. Reporter Ruta Olsenaida has more on today's edition of the Rebound Heartland Mother's Week.
Ashley Herring gave birth to her daughter, Alexia, just a few weeks ago. She's doing everything she can to protect her and her son Gunnar from COVID-19, even declining the chance for family to come visit in a typical fashion.
So that's my husband's mom and his sister, and it was really heartbreaking for us. You know, they want to meet and hold our new daughter and see our son.
Ashley is looking out for her children and getting them vaccinated. But what worries her is that other parents are not.
My daughter, who's just 3 weeks old today, she can't have all the vaccines yet. You know, she's on her schedule. I would hate to send her back to a daycare and then her get something from an older kid.
According to the Centers for Disease Control, child vaccinations have plummeted since the start of the outbreak. New findings from the CDC show that doctors are ordering about 2.5 million fewer doses of vaccines for preventable diseases due to lack of demand. And Nebraska is seeing a similar trend. We spoke with pediatricians all across the metro who say their numbers are down as well.
Seen about half of what we usually do at this time frame.
Data from the Nebraska Department of Health and Human Services shows that child vaccination rates drop 10 to 35% depending on age. The reasons for the drop mostly have to do with fear of exposure to COVID-19.
Parents have concerns about coming into a clinic where they could be exposed to infection.
But health providers are taking drastic steps to minimize risk at appointments.
There's some of our offices that are doing split days where half of the day is well visits, half of the day is sick visits. And there's also physically split offices that are only seeing well visits and some that are only seeing sicks, so that there is no cross-contamination.
With children not getting their regular vaccines, doctors worry that a preventable outbreak of diseases like measles or mumps will add to the difficulties of already dealing with a pandemic.
What would be very difficult is trying to manage not only the uncertainties of COVID-19, but some of these uncertainties of these vaccine preventable diseases that we haven't seen in a long time.
My stance on it is vaccines are important, and let's keep it at one pandemic, not two.
Call your pediatrician to find a right time and place to come in for vaccinations, because even though the spotlight is on COVID-19, other illnesses do have the ability to affect the health of your child. Reporting in Omaha, Ruta Olsenaida, 3 News Now.
The American Academy of Pediatrics has launched a digital campaign called Call Your Pediatrician to urge parents to contact their child's doctor and get reassurance that coming in for vaccinations is important and safe. We'll have more information on our website, 3newsnow.com.